I'm Dr. Rajiv Dang. I am HOD Internal Medicine Max Gurgaon, and I'm going to talk a bit about this stomach bug. So, the sudden appearance of explosive problems, they are majorly because of the viral particles or the toxins already stored in the food that is served to you. And in case it is only the infective organism which will enter into your body, create its army of attacks and then lead to problem, this will take a little time in development of the complaints. So what is the cause? The cause is that when the food production is in massive amount, the hygiene gets compromised. That means all those things which are grown in the soil, as most of them are, they are not very thoroughly washed. They may be washed. There is a difference between washing and thoroughly washing. And same is about the things which grow in the ground, they are not peeled. You go to a 5-star, ask for a salad, and you will see that radish and related stuffs will have small bits of roots and that brownish colored dust attached to it. So that's what is bringing the problems to us. So first is the food hygiene is not proper. Second is the guys who are handling the food, they are not well trained. They don't clean their hands thoroughly. Their nails are not trimmed. And above all, the vaccination of these individuals is not done. So the patients suffer because the food supplied to them is by the boys who might be carriers of certain diseases. You might have heard of a lady, Mary, who was carrying typhoid infection in her bladder. She was not having any symptoms. That becomes an asymptomatic carrier. And for months and months and months, she kept on passing those organisms in the stools. She was a serving person in the restaurant, and lots of people developed typhoid secondary to that. So I have some very basic suggestions for you to look after your health. One is, I think when I pay for the food, I have the right to have the hygienic food. So the place that you go to, be little choosy. Where you see the hygiene looks to be more promising, go there. Second, anything which can be picked up by my hands is likely to be a source of infection, because anything on my hand gets carried away to that food. So I have a very simple way of assessing this. If I need something cold, I will see to it that I pick it up sealed. And if I need something which is not possible to be sealed, then I'll pick it up as piping hot. So this is a very simple precaution that we can take and be better off. When you have this stomach bug related issue next day to the party, the best advice will be take physical rest and followed by rest to the intestines, because intestines are misbehaving. If you give them normal food to digest and then to absorb, they're going to face problems. So we will cut down our diet drastically and come to only liquid diets. I request and suggest everybody to take vaccine for typhoid, the conjugate typhoid vaccine, which works for 5 to 10 years or maybe more. I'll suggest basic care, vaccination, and in case there are any other queries in your mind, please write down in the box. We'll be more than happy to get back to you and reply. Thank you very much.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.